Hi, I'm Alex Regazio, and my final paper topic was physical therapy among HIV/AIDS patients. As a physical therapy major, I had not heard of the connection between the two before. HIV is the virus that causes AIDS. The HIV virus attacks cells of the immune system, and over time, the significant depletion of immune cells becomes known as AIDS. Physical therapy, on the other hand, has nothing to do with the immune system. Physical therapy consists of meeting up with a professional to develop a fitness program that helps a patient move, reduce pain, prevent injuries, and restore function. So how these two connect? Although physical therapy does not treat HIV/AIDS directly, it does complement current treatments that do. Physical therapy helps deal with the side effects of current treatments in the process of aging with HIV, thus increasing the patient's quality of life. It is a non-pharmacological treatment that should be utilized more often. Today, highly active antiretroviral therapy is the most commonly used treatment. It involves taking medications every day and has been proven to become a life-extending treatment. In 1995, a 25-year-old diagnosed with HIV could only expect to live about 8 more years on average. Now, today, that same 25-year-old diagnosed with HIV could expect to live about 33 more years on average, an increased lifespan of 25 more years. This expresses the need for physical therapy as a treatment itself. Physical therapists will tailor treatments that take the HIV/AIDS disease into account by providing customized exercise programs. These exercise programs can help deal with the disease-related myopathy, neuropathy, balance and walking issues, aerobic capacity, and even obesity. So why isn't physical therapy a more common treatment for patients with HIV/AIDS? Well, many healthcare providers today are extremely cautious when prescribing physical therapy to the HIV/AIDS population. It is a known fact in the scientific community that heavy exercise or prolonged exercise among healthy individuals can temporarily deplete immune cells for 3 to 72 hours after that exercise. So why would you want to put someone who already has a depletion of immune cells into a program where it could further deplete it? This is why physical therapy among the HIV/AIDS patients is currently in the stage of conducting research in numerous clinical trials. Research in clinical trials so far has provided evidence that physical therapy programs should be prescribed by these healthcare providers. In the multiple studies I researched, moderate exercise during any stage of the HIV/AIDS disease was proven to be both beneficial and safe. The Cochrane review stated that patients with HIV/AIDS could do constant aerobic exercise for 20 minutes a day, 3 times a week, for 4 weeks safely without damaging the immune system. Further research will continue to play a huge role in order to make physical therapy a more valid treatment for patients with HIV/AIDS. Lastly, I would like to make the connection to human rights. For people with HIV/AIDS, they face many human right violations, whether it be the stigma and discrimination or simply being denied the right for treatment. There needs to be a global effort in order to achieve universal access to health care and to put an end to the stigma and discriminations. Today, there are 35 million people currently living with HIV worldwide, an estimated 6.1 million people in South Africa, 1.1 million people in the US, and 10,637 people here in Connecticut, all living with HIV. Through education of HIV/AIDS, there is not only promise to put a stop to it, but to also stop the human rights violations on a worldwide scale. And that wraps up my presentation.
And is there any physical therapy treatment of HIV patients currently going on in South Africa, or where is it more prevalent around the world?
More like along like the wealthy, it's not, in South Africa, they started the heart treatment a lot, so that is progressing, but I don't think they've implemented the physical therapy yet.
And is it more prevalent in the United States?
Yeah, that's where most of the studies are being researched that I came across.
Thank you.